स्पेशल थैंक्स टू माय फ्रेंड्स हु ट्रैवल्ड फ्रॉम लॉन्ग डिस्टेंस। मेरे दोस्त डॉक्टर समीर शफ़ी अभी ऑडियंस में से उठ के गए हैं, वो अभी आ जाएंगे। वो शिकागो से आए हैं, पेरिटोनियल डायलिसिस की कॉन्फ्रेंस अभी पैरेलल चल रही है उसके लिए, लेकिन वो इस सेशन के लिए भी आए हैं क्योंकि आई बिलीव कि हम पाकिस्तान से तो निकल जाते हैं लेकिन पाकिस्तान को हमारे अंदर से कोई नहीं निकाल सकता। अच्छा, तो ये मेरे सारे डिस्क्लोजर्स हैं एंड आई एम प्राउड टू हैव दीज गुड डिस्क्लोजर्स, क्योंकि आपको पता है कि कुछ ये मैं आई वर्क एट पेन स्टेट हेल्थ हर्शी मेडिकल सेंटर, पिछले 16-17 साल से उधर ही काम कर रहा हूँ, और एंड आई डिड माई नेफ्रोलॉजी फेलोशिप देयर एंड आई बीन फैकल्टी देयर। इस जो मेरी प्रेजेंटेशन है रेजिस्टेंट हाइपरटेंशन में 20 मिनट में एक ही उसका है पीस डिवाइस बेस्ड थेरेपी, जो कि रीनल डीनर्वेशन, उस पर मैं फोकस करूंगा। तो ये जो पहला ट्रायल है ना, टारगेट बीपीआई, ये आई एम द साइट इन्वेस्टिगेटर एट पेन स्टेट फॉर दिस पर्टिकुलर ट्रायल। So this is one of the renal denervation system. It's not FDA approved yet, but the other two are. So I will be talking about those FDA approved and non-FDA approved therapies. Balance DHF, ये trial अभी चल रहा है, वो combination pill की बात कर रहे थे डॉक्टर साहब। तो ये है combination of SGLT2 versus SGLT2 plus MRA for heart failure and diabetes. तो सबसे मज़े का जो है, अभी रिसेंटली NIH ने मतलब अब पॉलिटिकल क्लाइमेट तो आपको पता ही है, डॉक्टर अर्शद चीमा साहब ने भी बात की कि अमेरिका में रिसर्च फंडिंग का क्या हो रहा है, तो पता नहीं इसका क्या बनेगा, लेकिन दिस इज़ द R01 इज़ कंसिडर्ड गोल्ड स्टैंडर्ड फॉर रिसर्च। एनीबडी हु हैज़ R01 अमेरिका में उसको कहते हैं कि भाई ठीक है भाई, तुम एकेडमिकली अब ठीक हो, लेकिन हम पता नहीं क्या होना है फंडिंग का। सो दिस इज़ वेरी इंटरेस्टिंग स्टडी। ये हमारा एक कोलैबोरेटर है उधर यूनिवर्सिटी पार्क में, बायोमेडिकल इंजीनियर है। ही रीच्ड आउट टू मी एंड द रीज़न ही रीच्ड आउट टू मी आई विल टेल यू लेटर, कि वो बेरो रिसेप्टर स्टिमुलेशन की डिवाइस बनती है, तो इधर वो एक डिवाइस लगाते थे तो उससे कॉम्प्लिकेशन होती थी। तो नाउ वी आर मेकिंग दिस बायो एडहेसिव 3D प्रिंटेड स्पेशल मटीरियल, ताकि ये भी डिवाइस जो है ना वो फ्यूचर में हम इसको वो कर सकें लॉन्च। तो ये अभी फंडिंग अभी स्टार्ट किया रिसर्च, देखें इसका क्या आउटकम निकलता है। तो हाइपरटेंशन के ऊपर बात करेंगे। प्रेवलेंस आप सबको पता है, इट्स कॉल्ड साइलेंट किलर, वो डॉक्टर साहब ने फरमाया है, क्योंकि पता ही नहीं चलता कि कब वो पेशेंट को सिम्टम नहीं है तो इसका जो है ना इट जस्ट किल्स पीपल। और जो ब्लड प्रेशर टारगेट्स हैं उस पे किसी का वो हो ही नहीं रहा। नोबडी इज़ एग्रीइंग अपॉन, यूरोपियंस के अपने टारगेट्स हैं, स्प्रिंट वालों ने अपना चलाया है। देखें शायद कोई जो है ना नई स्टडी है, बल्कि अभी एक आई है, डॉक्टर आफ्ताब मोहसिन, आप तो स्प्रिंट के फ़ैन है राइट? तो वो जो BP रोड ट्रायल देखा आपने, जो नया चाइनीज़ ने बोला कि भाई हम जो है ना वो सो दे कंपेयर्ड 120 एंड 140 ब्लड प्रेशर टारगेट, तो 120 वाले ग्रुप को काफ़ी अच्छा 20% रिडक्शन आई है। तो हमें पता है सबको कि ब्लड प्रेशर का कंट्रोल ना सिर्फ पाकिस्तान में मुश्किल है बल्कि ग्लोबली बड़ा मुश्किल काम है। वी डोंट हैव ऑप्टिमल टारगेट्स अचीव्ड ग्लोबली। और देख लें मेन और वुमेन, 1/4 ऑफ द पीपल विद हाई ब्लड प्रेशर, देयर ब्लड प्रेशर इज़ नॉट कंट्रोल्ड। कोविड डिड नॉट हेल्प अस। सो आफ्टर कोविड एंड व्हेन यू कंपेयर दोज 2 years, द एवरेज और मीन ब्लड प्रेशर हैज़ गॉन अप। अच्छा, ये अभी थोड़ी देर पहले आपने सुना कि अगर आप ब्लड प्रेशर को कम करते हैं तो व्हाट्स द इम्पैक्ट ऑन द कार्डियोवैस्कुलर रिस्क। ये बड़ा इंपॉर्टेंट, आई थिंक आपने भी एक स्लाइड प्रेजेंट की राइट, कि अभी के 5% अगर आप ब्लड प्रेशर को 5 मिलीमीटर ऑफ मर्करी कम करें, ये एक मेटा एनालिसिस जिसमें कोई 3.5 लाख पेशेंट हैं, तो यू गेट 10% इम्पैक्ट, जो कि सिग्निफिकेंट है। और अगर आप 10 मिलीमीटर ऑफ मर्करी ब्लड प्रेशर को कम कर लेते हैं सम हाउ और दी अदर, तो इम्पैक्ट इज़ लाइक 20% रिलेटिव रिस्क रिडक्शन। तो मज़े की बात है, वो जो नया ट्रायल जो चाइनीज़ ने किया BP रोड, उसमें भी उनकी जो रिस्क रिडक्शन है वो इतनी ही है कि वो जब वो 120 पे मेंटेन कर रहे हैं तो इट्स 20%। सो इट्स नाउ प्रूवन विद मोर डबल ब्लाइंड प्लेसिबो कंट्रोल ट्रायल एज वेल। तो वी ऑल नो पेशेंट्स ब्लड प्रेशर मेडिकेशन नहीं लेते, द एडहेरेंस इज़ पुअर। So there are several studies, they quantified this. 44% patients were not taking all of their blood pressure medication. So you can go up on the doses, you can go up on the number of pills, you can use the combination pills. Almost, half of them are not taking, and 17% patients were not taking at all. I'm sure आप सोचें अगर को आपके प्रैक्टिस में होंगे ऐसे पेशेंट जिनको या तो इंटॉलरेंस है, या वो मेडिसिन लेना नहीं चाहते, या वो मेडिसिन लेते नहीं है, या फिर साइड इफ़ेक्ट्स की आपने बात की, तो इट्स ए ह्यूज चैलेंज. तो विदिन द ब्लड ग्रुप दिस ब्लड प्रेशर की उसमें रेंज में व्हाट इज़ रेजिस्टेंट हाइपरटेंशन. सो दिस इज़ टिप ऑफ द आइसबर्ग, एंड आई एम श्योर डू यू सी दिस अ लॉट इन पाकिस्तान. So resistant hypertension, the official definition is that if the blood pressure is still above the goal, when you use 3 agents at full doses, including a diuretic, and or when you take 4 pills and blood pressure is controlled, so that's controlled resistant hypertension. So pill burden is important, combination therapy is important, so the definition even incorporates that as well. But please make sure you rule out the white coat and secondary or resistant hypertension from renal artery stenosis, etc. अब होता क्या है कि the more you give, the less they take. I'm sure everybody is familiar with this. So my talk will focus on none of the medicines but device-based therapy and especially renal denervation. तो ये सिंपैथेटिक नर्व एक्टिविटी, इसकी पुरानी हिस्ट्री है. लोगों पहले ज़माने में सिंपैथेटिक नहीं करते थे, लेकिन पीपल स्टॉप यूजिंग इट बिकॉज ऑफ द साइड इफेक्ट्स इंक्लूडिंग डेथ एंड सम ऑफ द अदर मेजर साइड इफेक्ट्स. Renal denervation is like these nerves are also on the kidney, so it's more selective denervation rather than cutting somebody's entire sympathetic nervous system. So what are these nerves? So kidney, this is interesting. So kidney can send a signal back to brain, or kidney actually receives signal from the brain. So isme renal efferent nerves. So when kidney receives the signal from brain, renin go up, RAS system is activated, more sodium retention, more renal blood flow, and blood pressure goes up. On the flip side, where kidney is actually sending a signal back to the brain, it has other biological effects like vasoconstriction, resistance of insulin, sleep disturbance. So obstructive sleep apnea, as an example, is a known factor for resistant hypertension. And also it can cause arrhythmias, lone AFib you are hearing more and more, especially with aldosteronism. And it works on the RAS system to cause this ongoing blood pressure, because kidney is very central to blood pressure control. That's what we all know. So what are these renal nerves? So, and where they are located. So you see that they come from the trunk, they come from the aorta, they go on the renal artery, and then somewhere either distal or where the renal artery bifurcates, it actually anchors inside the vessel wall. So if you see this picture, you see this vessel lumen here. This is the intermediate media of the vessel. This is the adventitious, and renal arteries these nerves are really outside of that renal arteries. So really you can see in this picture, so these are the arteries. Really उसके आस-पास जो है ना वो जा रही हैं, artery के साथ-साथ these nerves जा रही हैं. So you can see this is another picture. Kidney also has the accessory artery and a lot of renal nerves on that. So important thing is like we need to make sure that when we perform the procedure is done distally, main renal artery, as well as the branches. And this was the original data which confirmed the really proof of concept as what happens if you interrupt the activity, the norepinephrine actually goes down, and then you can see that 70% to 92% based on where you are doing. So there are 3 systems in USA right now which are, there were many in the early stages, but these are the 3. 2 are the FDA approved. So Medtronic's spiral system, Recor, which is in the middle, that's used the ultrasound, and the ablative solutions, which I think I showed you the trial, which use a special system and inject the alcohol in the renal arteries. So how does this work? Let's see what the Medtronic system works. आवाज़ इसमें आ रही है कि नहीं? हाँ इसमें आओ वीडियो में. Okay, so really you go up in through just similar to what when you do the heart cath, you go up, you go in the renal artery. The spiral system is kind of a spiral thing, so there are 4 places where it actually releases this radio frequency ablation energy, and it kind of, because of this energy delivery, it really creates some fibrosis and kills selectively those renal nerves to interrupt that, the renal nervous system on that. And you do it on one side, you have to do it on the other side. It's a same-day procedure. Patient come in, under local anesthesia and can be discharged same day as well. It takes 30 minutes to 50 minutes based on the operator. So you can see that you do on both sides in the branches as well as the accessory nerves. So you take the catheter in, you turn the machine on, there is a generator there, it will release the energy that will cause all this denervation. And then this was the ReCore Paradise system. So really, you see that, you can see the activity on the renal nerves, and then the catheter will go in, they will reach at the site, and release actually ultrasound. I think the video is playing or not. It was playing before. So anyways, it's similar to what I showed you before. So it will go at one spot, then you come back and do it again, then you come back and then third spot. So like different places. So really the goal is to make sure that you reach to most of the nerves. So that's why the third system, when it injects alcohol based through a special needle system, it really captures the circumference of the artery wall from inside out, really to reach all the renal nerves, to make sure that, आप imagine करें ना, अगर इस कमरे की 4 दीवारें हैं, यहाँ पे वो वायर्स, इलेक्ट्रिकल वायर्स जा रही हैं चारों तरफ, तो आप अंदर कमरे के अंदर से कैसे उसको जो है ना वो डीनर्वेट करेंगे या उसकी वो बिजली की सप्लाई काटेंगे. So this was really the concept, that you go inside the door, inside the kidney artery, go to the wall and then really interrupt that electrical current, which is in this case, sympathetic activity. So going back to these trials, so first, of these trials was this Simplicity hypertension trials. That showed reduction of blood pressure to 30 millimeter of mercury systolic. So that was considered game changer. There were some side effects, but manageable, hematoma, renal failure, but some of those, they were able to manage. There were 3 deaths as well, some related to the procedure, some unrelated, but this was reported. But what happened after the trial number 1 and 2, they did this third trial, it's called Simplicity Hypertension 3. They added a sham control. So sham control is like you bring the patient to the cath lab, you just kind of do something as patient thinks that the procedure is done, but you don't do the procedure. Actually, one of my patients had a sham procedure. I did not know, I was the blinded investigator. Patient did not know. We all thought he had the procedure, but he did not. But when they actually used a randomized control, and when they added sham to it, they saw that there was no difference. So initial trials show a blood pressure reduction of 30 millimeters of mercury, but the sham controlled blinded trial did not confirm that. So all the hype was gone. And then people thought maybe, there was too many changes in the medication. They were not getting all the nerves. They were not getting it done completely. So then the different societies, they came forward to make sure that we have standardization of the trial, standardization of the equipment. So really they wanted to relook, because it's not how, you see, these are all the number of trials which were done. The purpose is not for you to look at these, but you can see that so many negative trials until we reach to some positive trials. So this is the timeline for these trials. I showed you this Simplicity Hypertension 3 trial. This was in 2014. Back in 2014, before that, my boss came to me and asked me to do the hypertension specialization, which was by the American Society of Hypertension. I said, why? They said, we want to bring this simplicity. They were trying to do, I think, 4 or something. And then when everything went down, I did the certification and then the trial did not come. So, but it was not until this 2019 we got this target BPI. So they reached out to us because we had the infrastructure ready, we had the cardiologist ready, I was ready. So we were engaged into the trial, and then eventually the RO1 was an offshoot because we were engaged already in the trial. So one point to remember, research is a team sport. You cannot do it alone. So for this slide, so there are 3 systems I show you. So you can see the colors. The purple one is the ultrasound, the blue, light blue. I'm not color blind, but I cannot say all these colors properly. It's radio frequency ablation, and yellow is the ethanol. If you are in the oval, those are the positive trials. If you are in the kind of this rectangle, those are the negative trials. So you see that after many negative trials. Finally, we started to have more positive trials. So this is a summary of all the trials, because I don't think I have time to present all those, but this is important. So what they actually saw from these trials, so you can see there are trials which are off med, like somebody is not taking any medicines at all, just to tease out the confounding effect of the medicine. And the other was like somebody was truly resistant. So they wanted to see that, whether this works or not. And these are mostly sham controlled. They also used that triple combination pill in one of the trial, just to make sure that confounding was minimized. So you can see that office blood pressure, which is the lower graph. So some trials show a reduction of blood pressure of 10 millimeter of mercury, 9.5. So anywhere on average 9 to 10 millimeter of mercury reduction was noted, which is equal to 1 blood pressure medication. So this was the this was the trial which was done by those target people, and really the system is like, I showed you the needle that goes in and it injects the nerves there. Their results are out, but not as robust as the other two trials. So hence the FDA approved the other two systems, not this one. So how it matters for your patient? One phenomenon they described, that it is always on, which means like once you do it for the next several months to years, the effect is persistent as compared to 12 hours on and off when just before the next dose, the blood pressure is high. So this is real-world experience for 3 years by Simplicity Registry. So there are 4,000 patients. You can see that office blood pressure, the year number 3, is still the persistent impact of 16.7 millimeter of mercury. So you do it once, and then 3 years down the road, their blood pressure is lower, and you can see their baseline blood pressure was 166 in that group. It works across various patient subgroups as well. So it's not just like only one subgroup, except that if somebody has renal artery stenosis, they wanted us to make sure that we stay away. There are some contraindications. How safe it is. I'm sure everybody, you will ask how safe it is. So earlier systems were quite unsafe. More recent, if you compare it to a standard acceptable safety level, the complications are lower. There was only one complication, which was, I think somebody probably caused problem. They ruptured the renal artery, and then it was repaired subsequently. So in summary, if this is the patient in front of you, would you send that patient for renal denervation? Or I run the hypertension clinic, and we don't accept every single patient coming with high blood pressure for this procedure. So let me ask you to think about maybe some patient population you would really like to refer to us. So when patient come to you, you really need to work on their blood pressure control in office, out of office, compliance, lifestyle modification, just to make sure that you're not missing white coat hypertension, you are not missing some other problems, you're not, give them combination pill, try to do it. Then you will find that, it will come down to two specific group of people. One, where they do not tolerate a lot of medication, either allergies, or the second is the truly resistant. You have tried every single thing, they have refractory resistant hypertension, so you want to try on them. Rule out the secondary causes. There are 3 secondary causes which I like to rule out. One is the aldosteronism, easy to do, you just a blood test. One is the renal artery stenosis, and the other is sleep apnea. So because these are all treatable things, you can send them to a different therapy as compared to this denervation. And there are some contraindication if there is renal anatomy issue, there is kidney cancer, there is pregnancy, or they have significant renal artery stenosis. So in summary, this is an outpatient procedure. Effectively reduce blood pressure to 1 blood pressure medication, but we have to remember that the effect is always on as compared to on and off. Try to do lifestyle modification first before you jump onto this therapy. Patient selection, very careful. You have to be careful, especially recently FDA approved this, so a lot of systems in US, they are trying to jump on, start doing this, and you need a multidisciplinary team, really a good cardiologist or a good interventionalist, and somebody who can manage these patients immediately post-op. But once the procedure is done, these patients, we have good data that the blood pressure effect can be effectively maintained for a while, and I showed you we have 3 years data. So thank you very much. questions in the end?
I think we can take a couple of questions. Let me ask you,